This is a timeline of events leading up to the coronavirus quote-unquote pandemic. And I've gone ahead and put it into a blog post so I can help maintain my train of thought here. But just to get an idea of how much money has been spent on this by the U.S. government since 2008, so about the last 13 years, the U.S. government has spent, actually an updated number here, $41 billion on allergy and infectious disease research. So quite a chunk of change. That's starting off in 2008 till current day. And there's also a graphical timeline right here that has all the same information. This is available to the public. There's a link on the blog post. So starting off in 2008, we've spent that $42 billion. On October 30th, 2013, EcoHealth Alliance announces the discovery of a new SARS-like coronavirus in Chinese horseshoe bats. EcoHealth Alliance and the USAID Predict Project are working together to predict and prevent the next pandemic, such as a outbreak of SARS in the wet markets. And that information comes right here from the EcoHealthAlliance.org. The SARS-like coronavirus discovered in the bats in 2013, and all the way down to where they talk about the outbreak in the wet markets. And they're working with USAID Predict. And just kind of a funny thing about them, they have this logo right here, and you can see it looks exactly like all the depictions of the Masonic handshakes. All the different ways that they do their handshakes, and just kind of a funny graphic here on the Predict logo where it essentially looks like the Masonic handshakes that they always do. So in 2013, they had found the SARS-like coronavirus in the bats and knew about them leaking into wet markets. So in 2014, the United States gives $3.3 million to EcoHealth Alliance, linked directly to the Wuhan Institute of Virology, to study bat coronavirus emergence. And of course, the first payment is $666,000. Here is the government budget and all the payments to EcoHealth Alliance starting in 2014. And the first payment right here for $666,000 on EcoHealthAlliance.org. We can see that EcoHealth Alliance scientists in partnership with Wuhan Institute of Virology. So here we know that EcoHealth Alliance that's receiving these payments from the government is working hand in hand with Wuhan. And that may be why Trump cut the research money, which was going to China. All the funding for EcoHealth Alliance had been cut. So they discovered a SARS-like coronavirus in Chinese bats. That's when we started giving money to China to study the viruses. And the next thing that happened was the government ceased gain-of-function studies. The government ceases funding of gain-of-function studies which make viruses more dangerous. A gain-of-function mutation is a type of mutation in which the altered gene product possesses a new molecular function or a new pattern of gene expression. So they're gaining a function instead of losing a function by that mutation. And why this is important is because it proves that the United States government was doing risky disease research and that they were doing gain-of-function mutations that were making viruses more dangerous. In order for that to come to a halt, it has to be going on in the first place. Now, the gain-of-function studies on viruses were resumed shortly thereafter, so the United States continued to perform gain-of-function mutations. And about 2 years later, Anthony Fauci says that there will be a surprise outbreak.
Is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak.
So in the coming administration, there will be a surprise outbreak. And how does he know there's going to be an outbreak in Trump's administration? Because he's the one who's been funding the research for the past 3 years. Now, this is a speech that Anthony Fauci gave in 2017. And here are the slides that he displayed during the speech. And funny, they're trying to blame it all on nature, but of many interesting slides, we could definitely pay attention to the pandemic preparedness plan, where they will be doing international surveillance, domestic surveillance, and vaccines. So that was Fauci's warning about the coming pandemic. And about a year later, EcoHealth Alliance announces the discovery of SARS-like coronaviruses spilling over into people in China. This is March 2nd, 2018. And this is the article that was quoted earlier, where EcoHealth Alliance scientists are in partnership with the Wuhan Institute of Virology, and they're working on SARS coronaviruses in bat caves. So about a year after finding that SARS coronavirus in the bat caves, the Department of Defense announces bidding for CB-192-006. This is a Department of Defense bidding for chemical and biological defense project, and it specifically mentions coronavirus 16 times. Starting on May 2nd, 2019, they are studying emerging viruses, coronaviruses, severe acute respiratory syndrome related coronaviruses, zoonotic coronaviruses, so those coming from animals, and all kinds of other references to coronaviruses and coronavirus infections, and its ability to have cross-species transmittability. And they want to develop antiviral drugs to be used as therapeutics in the events of a disease following human exposure to emerging viral agents, such as the ones we just seen. So it looks like they're getting ready for a coronavirus outbreak. Zooming in a little bit here, about 2 weeks after that, Fort Detrick is hiring for an animal caretaker, and this may or may not be relevant, but it does suggest that at Fort Detrick they have animals housed there, which is relevant because they've been doing a lot of research surrounding coronaviruses in animals. And about 1 month later, the CDC issues a cease and desist order to halt research at Fort Detrick at its highest security labs. The CDC says it's national security reasons and prevent any more details from being released. Deadly germ research is shut down at Army Lab over safety concerns. In a statement, the CDC stated national security reasons as a rationale for not releasing information about the decision. CDC to Army Lab, cease and desist studying deadly germs. Fort Detrick Lab shut down after it failed safety inspection. All research halted indefinitely. A couple days later, bidding for the coronavirus research is halted. Stops on July 1st, 2019. So they're no longer hiring to develop these antiviral drugs. The suspended research involves certain toxins called select agents and toxins, which are housed at the U.S. Army Medical Research Institute of Infectious Diseases at Fort Detrick. On the list of agents and toxins housed at Fort Detrick is coronavirus. Here's the select agents and toxins list, with the SARS-associated coronavirus SARS-CoV on the list. Here's their leadership, and he's worked as a biomedical research for 30 years over there at the U.S. Army Medical Research Institute at Fort Detrick. And the CDC inspection findings reveal more about the research suspension at Fort Detrick. The CDC demonstrated a failure of the Army laboratory to implement and maintain containment procedures sufficient to contain select agents and toxins. In other words, at Fort Detrick, they were not properly containing SARS-associated coronavirus. Now, to get an idea of where some of these are located at, the Department of Defense Chemical and Biological Defense Program, CBD, that's who was hiring for these jobs, the CBD 192-006 job. Their mailing address in Virginia is 8725, and Fort Detrick is 60 miles away from there. So here is Fort Detrick, and 60 miles away is that CBD program who hires for the coronavirus research. Here is their website and their address. So July 1st, bidding for the coronavirus research is closed. And then we have an unknown virus leak near Fort Detrick at a retirement home. July 11th, 2019, Green Spring Retirement Community near Fort Detrick and the CBD program report the community is exposed to an unknown virus where many elderly people are hospitalized and die, and some have contracted pneumonia. Here's a tweet about it. Green Spring Retirement Community exposed to an unknown respiratory virus, 18 hospitalized, 2 have died from the mystery virus. Respiratory illness outbreak at the retirement home kills 2 and sickens dozens more. Let's look at a map of where that's at. Here is the Green Springs Senior Community Living Center. There is the DoD CBD program. And here's Fort Detrick. A couple of days later, on July 17th, a second outbreak of retirement community suffers a mysterious respiratory illness. Once again, it is very near Green Spring, the DoD CBD program in Fort Detrick. Second Fairfax County retirement community suffers a respiratory illness outbreak, a mysterious respiratory illness. So here's the first retirement home outbreak, and a couple days later, the second retirement home outbreak. 1 day later, the very next day, on July 18th, the CDC completely shuts down the U.S. Army Medical Research Institute of Infectious Diseases at Fort Detrick. The CDC shut down an Army lab that's working on an Ebola vaccine. That's just a reference to Fort Detrick, but the CDC has shut down Fort Detrick. The Army lab that houses Ebola virus and other infectious diseases has been shut down due to violations found in June. So at first they had just issued a cease and desist, but now they've completely shut down the lab. About a week later, they say that no specific pathogen was identified as the cause of the outbreak at the senior community centers in Virginia. No specific pathogen is identified as the cause of the outbreak. And 3 days later, they release an update that says the CDC has indicated rhinovirus, a virus that causes the common cold. The first outbreak, the second outbreak, CDC shuts down the Fort Detrick, and right after that, we get the first ever vaping illness deaths, which start to begin all across the United States. There has been 39 deaths nationwide associated with e-cigarettes, and here we see the fourth Californian since July 2019, and that number has increased to 40. She's the fourth in California since July 2019, when the CDC began gathering data. She had symptoms of a cold from the previous days, went to the ER, got acute respiratory distress syndrome, and succumbed within 24 hours. And with all this talk of common cold, let's just remember that the American Medical Association Encyclopedia of Medicine lists coronaviruses as the common cold, and we know that's what it is, but all of these viruses and people with symptoms of common cold should lead us back to the suspicion that it's a coronavirus that's causing the illness. And this is when we start to see clusters of mysterious respiratory disease, which is linked to quote-unquote vaping. August 8th, clusters of mysterious lung disease are reported in the United States, mostly linked to vaping. But how do clusters form if it's non-communicable? August 8th, what's behind the cluster of vaping-related severe lung disease? August 19th, 2019, nearly 100 cases of a mysterious lung illness could be linked to vaping. It could be linked to vaping. And 2 days later, Event 201 is announced. August 21st, 2019, the Johns Hopkins Center for Health Security, in partnership with the World Economic Forum and Bill Gates, will host a global pandemic exercise called Event 201 on Friday, October 18th, 2019 in New York City. So what better time to have a global pandemic exercise? If we looked at the vaping illnesses, we might have a clue that the pandemic was already started. Here's the CDC's site with the outbreak of lung injury associated with the use of e-cigarettes or vaping products. And if you look at the graph here of when people got sick from vaping, it only aligns with the leak at the Fort Detrick facility. Right here is essentially when the leak at Fort Detrick happened. And right after that, there was a huge spike in vaping illness. And somewhere around here, they announced that the Wuhan was responsible for COVID. And after that, there was absolutely no more deaths related with vaping. Just interesting that there was a big spike in vaping illnesses only one time ever in history, and it was directly before COVID came out. Here is the peak on September 8th. with vaping-related emergency room visits. So really not much going on. And then a leak happened at Fort Detrick, a massive spike, and there really has never been any vaping illness deaths since then. There are 4 links between lung disease caused by vaping and coronavirus. The only spike ever aligns with the Fort Detrick leak. They both cause pneumonia and fever. The symptoms are almost exactly the same. Even lung CT scans, which are both very strange, are strange in the exact same way. Acute respiratory distress syndrome is the cause of death in both vaping illness and COVID-19. Vaping illness, more than half of the patients with fatal cases, 63% receive a diagnosis of acute respiratory distress syndrome. Same thing in COVID-19. More than 40% of the individuals hospitalized have acute respiratory distress syndrome. And this is a comparison of vaping illness to COVID-19. They both have the same thing that's called ground glass that happens in the lungs, and you can see the development through the different stages. Looks very same. You have this cloudy area here, and the cloudiness here and here look the same at that stage. It looks the same at this stage. This big white area kind of grows into the same shape, even kind of moved off to the right-hand side here. And there are a little arm here that comes down with 3 little arms off of it. And if you zoom into this one, you'll see the same thing. There's 3 little arms off of it. So the similarities between the vaping illness patient and the COVID patient are almost identical when you look at the CAT scans. So mysterious respiratory disease could be linked to vaping. Event 201's announced. The first and only boom of vaping illness here on September 8th. And fast forward about a month here, on October 15th, 2019, the 2019 Military World Games take place in Wuhan, China. The U.S. sends a delegation of 300 athletes and officials, including personnel from Fort Detrick. U.S. delegation arrives in Wuhan for Military World Games, October the 15th. 17 athletes from the U.S. Armed Forces have arrived in Wuhan. 300 athletes are expected to arrive in the next 2 days. Chinese official says the U.S. Army may have brought the epidemic to Wuhan. The virus may have been transmitted from a source or other sources to the seafood market, where the rapid spread of transmission began due to the presence of a large number of close contacts within the place. And the research also found that the virus began spreading after the Wuhan International Military Games ended in October 2019. And it is expected that patient 0, or the first person with COVID in China, has come from outside of China. And let's remember that the incubation period for COVID-19 can last up to 14 days. The incubation period for COVID-19 can be up to 14 days. So even if the virus was released at the military games, we probably wouldn't have seen anybody with symptoms until early November. And actually on the same exact day of the Wuhan Military World Games, which occurred on October the 18th, that's also the same day that Event 201 happens in New York City. And here's their statement about COVID and the pandemic exercise. We hosted a pandemic tabletop exercise called Event 201. Nothing like a good old tabletop game of COVID-19 with Bill Gates. And to be clear, the Center for Health Security and Partners did not make a prediction during the tabletop exercise. Just to be clear, we were not predicting anything, even though everything that we did came to reality. We modeled a fictional coronavirus pandemic, but explicitly told everybody it was not a prediction. Our tabletop exercise included a mock novel coronavirus. 1 day later, Maryland, the home of Fort Detrick, is the first state in the United States of the 2019-2020 flu season to report widespread influenza. This is the weekly influenza surveillance report, and the week ending October 19th, 2019, we can see that Maryland is the only state with widespread influenza. And right on par, about 2 weeks after the Wuhan military games on November the 17th, 2019, the first case of someone in China suffering from COVID-19 is reported according to government data. China's first confirmed COVID-19 case traced back to November 17th. and 55-year-old individual dates back to November 17th, 2019. So here we got Event 201. The same day is the 2019 Military World Games in Wuhan, bringing 300 U.S. personnel. Same exact time, Maryland is the first state with widespread influenza. And about 2 weeks after the Wuhan Military Games, or close to 3, the first case of COVID-19 in China. And it took a couple more months after that, but by January 26th, 2020, the disease outbreak, which started from a wet market, has grown substantially to infect 2,761 people in China. A pneumonia outbreak associated with the new coronavirus of probable bat origin had caused 2,974 laboratory-confirmed infections, including 80 deaths by January 26, 2020. Let's take note that the Wuhan Center for Disease Control is located 900 feet from the wet market. So here's where the wet market supposed leak happened. And here's the Wuhan Center for Disease Control and Prevention. Vincent Ransoniello, professor of microbiology and immunology at Columbia University in New York, and one of the top RNA virologists in the world, said, if someone had that bat coronavirus in the lab and say it escaped, it would not have been able to infect humans. The human SARS-CoV-2 had additional changes that allowed it to infect humans, he said, adding that the bat virus would have to circulate and evolve for a number of years, possibly 2014 through 2019, before mutating enough to be able to infect people. And the World Health Organization has said that the exact path the virus took between its animal source and humans is still unclear. It seems pretty clear to me, though. So that concludes the timeline and my thoughts about what exactly happened. I'm going to leave on the blog. But what I do want to know in the comments, what do you guys think happened? And who do you think started the coronavirus? Thanks for watching.